many of our listeners here are in the healthcare profession. It's a healing. They got into it because they wanted to be healers. They wanted to help people become whole and recover. But we see this manifest in the healthcare system, don't we? I mean, how does it come out in the healthcare system?
Well, the vast differences in disease, mortality, and morbidity. Nothing reflects it more dramatically right now, than the COVID
Mm,
dynamics. Some people are simply awestruck by the levels of disparity in
yeah,
terms of Black and Brown people and people of low income having so much more both incidence of and death from. Honestly, Wayne, I have lots of friends who are people of color and who are white. And I can say to you that none of my friends who are white have lost family members to COVID. And at least five of my friends who are Black or Brown have. I mean, so I've had a chance to just
very good.
live this, right, and see it.
Seen it.
Um, but it shows up, I think, in COVID because of the vulnerability that comes with a lifetime of exposure to the structural barriers to opportunity. So you've got lower wage, you've got more fragility in terms of access to affordable housing, you've got more institutionalization in the jails and prisons. You've got all those factors. You've got people working as quote essential workers now. They weren't considered that, prior to March, but
Right. They weren't
you know,
essential before.
right, but they have to show up, in terms of the grocery stores and the retail outlets, et cetera. So they're more exposed to the virus and they probably don't have the protective personal equipment, the PPE. So you've got this storm of exposure and then deeper vulnerabilities that are associated with the metabolic syndrome that's associated with poor diet and excess stress. I mean, I did an interview mid-March and I said, this is what's going to happen, because it's very clear that the communities where there's more obesity, there's more diabetes, there's more heart disease, they're going to be at greater risk for the lethal effects of exposure to this particular virus.